So now I'm going to discuss about lymphadenopathy. What do we mean by lymphadenopathy? Lymph nodes are our primary line of defense. Supposing you get a caries tooth, all your lymph nodes below the neck will be inflamed. Often the mothers of the babies come to us, my baby is having a persistent lymph node here or in the occipital region or here or there. Even if you have lice in your hair, then too also you can get occipital lymph nodes. If you have a caries tooth, you can get submental lymph nodes. So once a first line of defense means anything which happens, any infection which enters the body, be it bacterial, be viral, be fungal, be parasitic, we get some increase in size of the lymph nodes, which is significant. Now, what is that significant size? It is more than 1 centimeter in cervical nodes, that is nodes of the neck, and more than 1.5 centimeters in the axillary and the nodes all over the body. It has to be more than 1 centimeter in these neck nodes and more than 1.5 centimeter in the rest of the body. So what is the normal feel of the lymph nodes? Normal feel is soft. It is neither attached to the skin nor attached to the underlying tissue. This is the clinical examination of the lymph nodes. Now there is a book by K.D. Chatterjee. You will get the position of the lymph nodes, how you examine, how you place the baby to examine the lymph nodes. I am not going into that details. I am telling you only the chains. So the cervical, you have a horizontal chain and a vertical chain. Horizontal chain, you have submental, just over here, submandibular, just at the angle, jugular, jugulo-omohyoid, submental, submandibular, jugular, jugulo-omohyoid. Now, there is a cervical horizontal group and a vertical group. This is the sternocleidomastoid muscle. According to the sternocleidomastoid muscle, we have a group, vertical group and a horizontal group. Anterior triangle, this is the marking of the anterior triangle and the posterior triangle. So there are the two branches of the sternocleidomastoid which are inserted here, that is on the clavicle. And among this, the middle one is the jugular vein goes. And the lymphatics accompany it, the vertical lymphatics accompany that vein, jugular vein. And the internal jugular artery is just internal to the sternocleidomastoid. Those of you whose children learn karate, they must be knowing where the jugular vein, jugular artery, where it is situated. Very important, life-saving measure. Or if you want to kill a person also, you can kill a person if you know the position of the jugular artery, internal jugular. That is the main artery which supplies our brain. So these lymph nodes, the sternocleidomastoid, anterior to it, it is horizontal group, and posterior to it is the occipital group, which goes right behind the nape of the neck. Occipital group goes right behind. This is the occipital part of the head. This is the frontal. This is the maxilla. This is the temporal, and this is the parietal bones. These are the parietal bones. These fuse in the middle to form the anterior fontanelle and the posterior fontanelle in the baby. Anterior fontanelle closes by 18 months and the posterior fontanelle takes a long time to close. And the occipital nodes are at the back of the head. That is in the nape of the neck and the back of the head, occipital nodes. Now similarly, in the axillary nodes, you have anterior, apical, posterior and central. Anterior axillary nodes, you examine from the front. That is, you can approach the anterior of the axilla from the front of the baby. You can feel it. And the other groups, the apical, the posterior and the central, are seen from the back. Central, posterior and apical. Inguinal, usually there are scratches and bites or scratches in the child's feet, and so inguinal are always inflamed in children. Inguinal, we don't take it into consideration until it is significantly enlarged, hard, attached to the underlying skin and feel is also firm, we don't consider it at all. We consider mainly cervical and axillary. And over here there is one lymph node, very, very important node. Why so? Because you get it only in certain diseases. So we have one lymph node over here also. So clinical examination of lymph node from anterior aspect, from posterior aspect, I've told you. Now I'm telling you about the field. Suppurative lymph nodes are tender. Tender means all the signs of inflammation, that is rubor, calor, dolor, that is pain, redness, swelling, everything is there for suppurative nodes. You understand it is a bacterial infection. It has caused bacteria, you use antibiotics. Suppurative node. BCG vaccine also gives rise to BCG adenitis. BCG adenitis, there are several views, but now we talk about BCG adenitis only when we discuss tuberculosis, not other than that, because there are several views, we will not discuss it here. Antibiotics do not work in pent-up pus. Pent-up pus, antibiotics, this is a line from McGregor, Surgical Anatomy of McGregor. This is a line, pent-up pus, antibiotics do not work. Like say if you have a cholangitis, that is your gallbladder, the bile containing the from the gallbladder, it is going to the, that is inflamed. Do you think antibiotics will work there? No, it will not. Unless and until you introduce a tube and take away the pus, only then it will work, the antibiotic will work. There has to be a road for the pus to come out. So a nick with a scalpel blade is the easiest way for a suppurative lymph node to do. Small nick with a scalpel blade. It should be deep, it should cut, supposing it is at the tip of the finger, there are septa in the finger, it should be hockey stick like. Hockey stick like means it has to cut all the septums of the finger, collagen fibers, and only then the infection will go. These are surgical tips from McGregor. Suppurative lymph node. A caries tooth may cause a suppurative lymph node. It is tender. It is in the submandibular region. The caries needs to be addressed. You have to either extract the tooth or you have to either seal it. What is a firm node? Firm or hard node, non-tender, it is a sign of chronic inflammation or infection. There will be matting in addition to that. Matting means 2 or 3 nodes will join together and form a matted lymph node. That is the sign of tuberculous lymph node, matting. Some lymph nodes may come to the outside with small sinuses and cause skin infection. That is scrofuloderma. That is skin tuberculosis. So a turban-clad Punjabi came to my Damdam Park residence. Suddenly, he had been sent from Institute of Child Health, Park Circus, to me because I had held a session on tuberculosis in medical college just before that. They thought I know everything about tuberculosis and they don't. It was not getting healed. What was it? It was a big matted lymph node in the cervical lymph nodes, and there were few sinuses draining from that to the skin. And that is called scrofuloderma. That skin infection of tuberculosis is called scrofuloderma. It comes to the sinuses come on its own. The matted lymph nodes, that is one attached to the other and to the underlying tissue, you can slide your fingers on it. You can see several nodes. It's called matting. It is called matting. The several nodes are called matting. And that matted nodes are draining to the surface by fine sinuses and drains and causing tuberculosis on the skin. That is called scrofuloderma. That baby was being treated at that Institute of Child Health for tuberculosis with huge amount of drugs, and it was not getting cured. I gave him simple first line ATD. He used to come to my kitchen also. That man from Durgapur, Whenever I was in the kitchen, he used to come right from the drawing room to the kitchen and peep in and say, "ठीक हो रहा है, ठीक हो रहा है, बहुत अच्छा है मेरा बच्चा." I was so happy. First line ATD, treating that baby. Baby was healing, and they were getting unnecessarily worried and anxious. If the lymph node is very hard and attached to the underlying tissue, it is most surely malignant. Malignant means lymphoma. We know lymphoma are of two types, Hodgkin's lymphoma and non-Hodgkin's lymphoma. I can tell you of two cases. One is a non-Hodgkin's lymphoma, which was diagnosed in Sagardatta Medical College. I needed about 18 units of blood transfusion, 18 units of PRBC before I could diagnose it. Then that case was presented in a clinical meeting. I called all hematologists from all over Calcutta to that conference, and what they told me was, you should have done a LDH first. LDH. I'm not a hematologist, I'm a pediatrician. I did not know that LDH gives an indication to malignancy. After the 18th transfusion, we did a bone marrow and we got it in the bone marrow. That is in the 4th stage. That had gone in the 2 years, it had gone to the bones. But that baby survived because Hodgkin's disease is a very easily treated disease. ABVD 6 cycles cured the disease, my baby. And I know that he has opened a shop for rolls and he sells it now. That too I got the message. He sells kati rolls in a place near Central Avenue or Chitpur. Chandan, his name was Chandan. I remember his name also. That was probably in Arjikar, not in Sagardatta. It was in Arjikar, initially when I was a lecturer. Then I learned about LDH. So similarly, many things you learn from other doctors. There is no harm. The whole life you continue learning. So lymphadenopathy, this is the way you differentiate from suppurative to matted to hard or malignant nodes. You only by clinical examination. And the position you have to learn from K.D. Chatterjee, position of the lymph nodes. Each and every lymph node has to be seen in the correct position. That you will learn. There's a book by K.D. Chatterjee. It's mainly a book of orthopedics. Orthopedics, you see it from there. So this is a child showing cervical lymphadenopathy. You can see that the lymph node mass is extending beyond her mandible, beyond her cheek. It is outside the cheek of the baby. On this side it is normal. This side is outside the cheek of the baby. That means it's a huge node. In this case it was a lymphoma because it was hard and it was attached to the lower nodes. And you do a chest x-ray, CT scan of the chest, of the abdomen to see if any nodes are there along the backbone. If you get according to it, you can see it below the diaphragm, above the diaphragm. You do a computer tomography of the neck, chest and abdomen and pelvis to see large masses of lymph nodes. And then after that you can do a USG guided, you can take out a CT guided or USG guided lymph node, you can aspirate and you can send it for examination. We can see that the submandibular, normally there's a furrow over here in between the mandible and the posterior muscle, neck muscles. Now that is obliterated in mums. If you get bilateral parotitis, it is obliterated. Over here, it's an exaggeration of that. That is, a lymph node is protruding behind the mandible. And it is huge. The size is huge. The node is starting from under the ear and it is extending up to this part. It may be many nodes. It may be hard. It may be suppurative, whatever it is. You can see from the swelling that the swelling is much more than normal. So now you have to investigate. You have to do the blood, you have to do the bone marrow, you have to do the antitubercular, the CB-nat of the sputum or the gastric lavage. You do it and you understand. You see the mouth and the mouth cavity, you see the oral cavity, you see if there's any caries or any other thing. In malignancy, another thing that you get is often you get a depression of all the three blood counts. For that, you examine the oral cavity more, you can get purpura inside. That is called wet purpura. Wet purpura is a sign of imminent bleeding. The child will bleed immediately after that. If the platelets go down, you can get wet purpura inside the mouth. Dengue. Dengue. A child who bleeds will have wet purpura inside the mouth. Supposing it's an acute lymphoblastic leukemia, you get purpura, wet purpura inside the mouth. The child will bleed imminently, but just a few days after that. So the examination of the oral cavity is very, very important for that. Examination of the teeth, and whether it is milk dentition or permanent dentition, the oral cavity, the palate, the tongue, all the walls, everything you have to see of the mucosa, oral mucosa, at least up till the palate, soft palate. You will get many findings over there. In case of viral infections, you can get enanthem. Like we get exanthem in measles, you can get enanthem inside the mouth, that is rashes. You can get coplic spot in case of measles, that is salt in pepper appearance near the molar tooth in measles. I won't go into that. This is lymphadenopathy.